Did you know that over 70% of people engage in daily masturbation, but most have no idea how it's truly impacting their body? What if I told you that this seemingly harmless habit could be doing things to your body you never expected, both good and bad? From boosting your health to surprising hidden risks, the truth will shock you. In this video, we're diving deep into the science of daily masturbation. You'll uncover surprising facts about how it affects your physical health, mental well-being, and even your energy levels. Stick around because we'll also debunk some of the biggest myths you've been told about masturbation and reveal tips to maintain a healthy balance. By the end of this video, you'll have all the answers you've been curious about but were too afraid to ask. You'll learn the unexpected benefits, the hidden dangers, and how to ensure this habit doesn't interfere with your daily life. Trust me, you don't want to miss this. Welcome to Wise Wellness, the place where we uncover the untold truths about health, wellness, and life's biggest questions. If you're ready to explore more fascinating topics like this, make sure to hit that subscribe button and turn on the notification bell so you never miss out. Now, let's dive right into it and uncover the truth about daily masturbation. Before we talk about the effects, let's take a moment to truly understand what masturbation is. Simply put, masturbation is the act of stimulating oneself sexually, often to achieve pleasure or release. It's a natural activity that has been observed across cultures, genders, and ages for centuries. But there's more to it than just the act itself. Studies show that masturbation is far more common than most people might think. In fact, research reveals that around 80% of men and 60% of women admit to engaging in masturbation at some point in their lives. Among younger adults, the numbers are even higher, with nearly 95% of men and 70% of women between the ages of 18 to 25 reporting it as part of their routine. Interestingly, it's not just limited to the younger generation. Middle-aged and even older adults also report engaging in this practice, proving that it transcends age. And when it comes to gender, there's a fascinating contrast. While men tend to masturbate more frequently, studies suggest that women experience just as much sexual satisfaction through it, though they may approach it differently. It's a private subject, yet it's one of the most universally practiced and least openly discussed behaviors in human history. Now that we've established what masturbation is and how prevalent it is, let's move a little deeper into how this seemingly simple act impacts the body and mind in ways most people never consider. Before we talk about the potential downsides, let's first explore the positive physical effects of daily masturbation, because yes, there are benefits that many people don't even realize. First, let's talk about stress reduction. Daily masturbation can actually serve as a natural stress reliever. When you orgasm, your brain releases endorphins, often referred to as feel-good hormones. These chemicals help reduce stress levels, elevate your mood, and leave you feeling more relaxed. It's like your body's way of hitting a reset button during a tense day. Another surprising benefit is improved sleep. Have you ever noticed how relaxed and sleepy you feel after an orgasm? That's because sexual release triggers a drop in cortisol, the stress hormone, and increases oxytocin and prolactin levels. These hormonal shifts create the perfect conditions for deep, restful sleep. For some people, it's nature's way of winding down before bed. And let's not forget about prostate health, a topic that's gaining a lot of attention lately. Studies suggest that regular ejaculation, including through masturbation, might actually help reduce the risk of prostate cancer. The theory is that frequent ejaculation helps flush out toxins and old fluids from the prostate, keeping it healthier in the long run. Lastly, there's pain relief. This is one of the lesser-known benefits. During an orgasm, the body releases a flood of endorphins that act as natural painkillers. For people dealing with mild headaches, menstrual cramps, or even muscle aches, masturbation can provide temporary relief without the need for medication. Now that we've seen how masturbation can positively impact the body, let's shift our focus to some of the lesser-known risks and how these effects might change with daily practice. Before we get into the broader implications of this habit, it's essential to address some of the potential negative physical and lifestyle effects of daily masturbation. While moderation can be beneficial, frequent indulgence may come with certain downsides that are worth understanding. Let's start with physical discomfort. Overdoing it, especially without proper care, can lead to issues like genital soreness or swelling. Excessive friction during masturbation can cause irritation, leaving the skin tender or inflamed. In some cases, people may notice redness or minor abrasions due to repetitive motion. If this happens repeatedly, it can make the area more sensitive to touch, creating a cycle of discomfort. Using adequate lubrication and giving the body time to recover is crucial to avoid long-term irritation. Additionally, improper technique or overly aggressive habits might result in injuries that take longer to heal, such as small tears or even nerve sensitivity in extreme cases. Then, there's the issue of fatigue. While orgasms are known to produce a calming and relaxing effect, frequent masturbation can leave some individuals feeling unusually tired. This happens because, during an orgasm, the body releases a flood of hormones like prolactin and oxytocin. These hormones are responsible for the sense of relaxation and sometimes sleepiness after climaxing. However, when this is done too frequently, it can lead to an energy drain, leaving the person feeling lethargic. Over time, this tiredness can affect motivation, physical stamina, and even productivity, especially when masturbation becomes a daily habit without breaks. Perhaps one of the most concerning effects is the impact on daily life. While masturbation is a private and personal act, excessive indulgence might start to disrupt other areas of life. For instance, it can become a distraction from responsibilities, such as work, studies, or household duties. People who find themselves prioritizing this habit over their goals might start to notice a decline in their overall productivity. Additionally, it can interfere with social interactions. If someone becomes overly reliant on masturbation for stress relief or emotional comfort, it might replace real-life connections, leading to isolation or feelings of loneliness. This overdependence can create a cycle where the habit becomes harder to break, further impacting mental well-being and personal growth. Moreover, guilt or shame can sometimes accompany excessive masturbation, especially for individuals who feel they are losing control over the habit. This emotional burden can exacerbate feelings of isolation or self-doubt, creating a negative feedback loop that affects both mental and emotional health. Now that we've explored the physical and lifestyle effects, it's time to take a closer look at how these patterns may influence the mind and emotions. Let's dive into the psychological aspects next. Before we talk about how sexual experiences impact mental well-being, it's essential to understand the powerful psychological effects that can result from these intimate moments. One of the most significant and beneficial outcomes is mood enhancement. When we experience orgasm, our bodies go through a series of biochemical processes that have a direct impact on our emotions and mood. The brain releases a flood of dopamine, a neurotransmitter often referred to as the feel-good hormone. Dopamine is strongly associated with pleasure, reward, and motivation, and it's the same chemical that gets activated when we experience positive experiences, such as eating our favorite food or achieving a goal. During orgasm, this surge in dopamine produces a feeling of euphoria, providing an instant mood boost that can last long after the experience itself. This process doesn't only enhance immediate pleasure but can also play a crucial role in improving long-term emotional well-being. As dopamine levels rise, the body's stress levels tend to decrease, allowing a reduction in anxiety and an overall sense of relaxation. This is why many individuals report feeling happier, more satisfied, and less stressed after sexual release. Moreover, dopamine also interacts with other neurochemicals, such as oxytocin, often called the bonding hormone, which is released during physical intimacy. This further strengthens feelings of connection, intimacy, and trust, not just with others but also with oneself. The combination of dopamine and oxytocin creates an overall positive emotional experience, reducing stress and promoting a sense of contentment and peace. Before we explore these psychological impacts further, let's look at another powerful effect masturbation has, enhancing sexual self-awareness. Masturbation is often seen as a solitary activity, but its psychological benefits, particularly in terms of self-discovery, are invaluable. Many individuals struggle to understand their sexual preferences, desires, and responses because these aspects of sexuality are often underexplored or even stigmatized in society. Masturbation allows a person to explore their body in a private and safe environment, giving them the chance to learn what feels good and what doesn't, what triggers pleasure, and how different sensations impact their emotional state. This process of self-exploration can lead to a deeper understanding of one's sexual preferences and triggers. Through regular masturbation, individuals may discover what types of touch, pressure, or rhythms they enjoy, and this knowledge can be used to improve sexual experiences with partners. It also helps to establish clear boundaries, allowing individuals to communicate their needs and desires more openly. Additionally, masturbation can contribute significantly to improving sexual confidence. When a person has a clear understanding of their sexual body, they become more comfortable discussing their desires, whether with a partner or in a broader context. This confidence can extend beyond the bedroom, impacting other areas of life by increasing self-assurance and self-esteem. Furthermore, sexual self-awareness gained through masturbation is not just about physical pleasure. It can also improve emotional intimacy. For example, when individuals understand their bodies, they are less likely to experience shame or guilt associated with sexuality. This acceptance can lead to more positive body image, and a healthier relationship with one's own sexual identity. This openness to oneself often translates into greater emotional connections with others and a more fulfilling overall experience. Lastly, masturbation can also contribute to mental clarity and relaxation. The physical release of sexual tension often leads to a calm state of mind, which can be beneficial for managing stress and navigating challenging emotions. This self-awareness, combined with mood-enhancing dopamine levels, helps regulate emotions and provides a sense of mental peace and stability. Before we talk about the potential negative psychological effects, it's important to recognize that while masturbation and sexual experiences can offer many benefits, they can also bring up complex emotions and behaviors. One such emotional impact is guilt or shame, which many individuals may experience due to cultural or personal beliefs. For some people, masturbation can trigger feelings of guilt or shame, especially if they were raised in environments where sexual activity, particularly self-pleasure, was viewed negatively or taboo. These feelings often stem from societal, religious, or cultural norms that may frame masturbation as immoral or sinful. Even if a person desires to explore their sexuality in private, they may feel a deep internal conflict if their personal beliefs do not align with these actions. This emotional conflict can lead to feelings of worthlessness, anxiety, or self-judgment, which can impact mental health and self-esteem. The shame surrounding masturbation may also be tied to the way people are socialized regarding sex. If individuals grow up in environments that teach them to view sexuality as shameful or sinful, this can create a long-lasting sense of discomfort or confusion about their natural sexual desires. These feelings of guilt can lead to a cycle of self-criticism, causing individuals to suppress their sexual needs, which can further exacerbate mental distress. In some cases, this guilt can even cause sexual dysfunction, making it difficult for individuals to enjoy or engage in healthy sexual activities without experiencing anxiety or fear. Before moving further into other psychological impacts, we also need to address the potential for addictive behavior that can arise from compulsive masturbation. While masturbation is generally a natural and healthy activity, for some individuals, it can become an excessive habit that negatively impacts daily life. This can develop into what is known as compulsive or addictive behavior, where a person feels a strong, uncontrollable urge to masturbate despite potential negative consequences. This behavior may start as a way to manage stress or emotions but can quickly become a pattern of behavior that dominates the person's daily routine. Addictive masturbation behaviors can lead to a variety of psychological and emotional issues. For example, individuals may begin to use masturbation as a form of escape, trying to cope with feelings of anxiety, depression, loneliness, or stress. Over time, this coping mechanism can become more ingrained, leading to an unhealthy cycle where the person relies on masturbation to avoid dealing with underlying emotional issues. This can also interfere with personal relationships, as the person may withdraw from social interactions or romantic relationships in favor of engaging in solitary sexual activities. Moreover, compulsive masturbation can impact other aspects of life, such as work, study, or physical health. Individuals may prioritize masturbation over important responsibilities or may find that it interferes with their ability to focus or function effectively throughout the day. This constant preoccupation can create feelings of frustration, isolation, and a sense of being out of control. Before continuing, it's also essential to highlight how this behavior can cause psychological distress. As the compulsive nature of the behavior takes root, feelings of shame and guilt may increase, particularly if the individual recognizes the problem but feels unable to stop. This can create a vicious cycle, where the person feels trapped in their own behavior, leading to further emotional turmoil and a reduced sense of self-worth. In some extreme cases, compulsive masturbation can lead to physical health concerns as well. For example, repetitive overuse of sexual organs can lead to soreness or even long-term injury. In addition, the compulsive urge to masturbate may become so overwhelming that it interferes with the ability to experience pleasure or intimacy in other aspects of life, further deepening feelings of isolation and emotional disconnection. Before we talk about the myths and misconceptions surrounding masturbation, it's important to address some common beliefs that have circulated for generations, often causing unnecessary fear or guilt. One of the most persistent myths is that masturbation can cause blindness or infertility. This misconception has existed for centuries and can often be traced back to outdated cultural beliefs and medical theories. The idea that masturbation causes blindness is rooted in a time when very little was known about human sexuality or the physiological effects of sexual activities. The myth likely began as a way to discourage masturbation by invoking severe, seemingly dramatic consequences. In reality, there is no scientific evidence to support the claim that masturbation can lead to blindness. It is simply a false and baseless belief with no foundation in modern medicine or biology. Similarly, the belief that masturbation causes infertility is equally unfounded. The idea that engaging in self-pleasure could negatively impact reproductive health has been disproven by numerous studies. Masturbation does not affect sperm count or the ability to conceive. In fact, masturbation is a completely natural and normal part of human sexuality, and it does not interfere with one's fertility. Sperm production is a continuous process in the body, and masturbation in moderation has no long-term effects on reproductive health. Before we go further, let's also tackle another widespread myth about masturbation and its supposed harmful impact on overall health. There is a long-standing myth that masturbation can lead to severe health issues, such as physical damage to the sexual organs, weakened immune systems, or even mental health disorders. These myths often exaggerate the consequences of masturbation and cause unnecessary worry. One of the most commonly repeated myths is that frequent masturbation can lead to physical harm, like damage to the sexual organs. However, there is no medical evidence to suggest that masturbation causes any physical damage to the body. Masturbation is a safe and natural activity that, when practiced in moderation, does not result in physical injury or long-term harm. In fact, the body is built to handle this type of activity, and sexual organs are resilient to the normal, non-abusive stimulation involved in self-pleasure. Another health-related myth is that masturbation weakens the immune system. Some claim that excessive masturbation drains the body's energy or vitality, leaving it more susceptible to illness. This is another misconception with no scientific backing. Masturbation does not weaken the immune system, rather, it is a normal part of sexual health and has been shown to have various benefits, such as stress reduction and mood improvement, which can actually contribute to overall well-being. As long as it is done in moderation, there is no impact on the immune system. In addition to these physical concerns, there is also a myth that masturbation can cause mental health disorders, including depression or anxiety. While some individuals may feel guilt or shame associated with masturbation due to cultural or personal beliefs, masturbation itself does not cause mental health issues. In fact, it can be beneficial for mental well-being. Masturbation is known to release endorphins, which are chemicals in the brain that contribute to feelings of happiness and relaxation. It can help alleviate stress and improve mood, and it is considered a healthy way to explore one's body and sexual desires in a private setting. These myths about masturbation leading to severe health issues are rooted in misinformation and cultural taboos, rather than scientific fact. It's crucial to debunk these misconceptions so that individuals can feel more comfortable and informed about their sexual health. Understanding that masturbation is a normal and natural part of human sexuality can help reduce anxiety and improve overall well-being. Before we talk about expert opinions on masturbation, it's important to understand that medical professionals widely agree on the normalcy and health implications of the activity. Masturbation is generally considered a natural and healthy part of human sexuality, with numerous health benefits, provided it is done in moderation. Healthcare professionals, including doctors, psychologists, and sex therapists, have extensively studied the effects of masturbation on both physical and mental health. From a medical perspective, masturbation is seen as a completely normal behavior. According to many experts, self-pleasure is a common practice across cultures and age groups and is often a person's first experience with their own sexuality. It is also an activity that many individuals continue throughout their lives, regardless of age, gender, or relationship status. Health professionals stress that masturbation is not harmful and that it does not cause any physical or mental damage when practiced in moderation. In terms of health implications, numerous studies have shown that masturbation can provide several benefits. For example, masturbation can help relieve stress, promote relaxation, and improve mood by releasing endorphins, the brain's natural, feel-good chemicals. Additionally, regular masturbation can aid in improving sexual function and can be particularly beneficial for individuals who experience sexual difficulties or dysfunctions. By exploring their own bodies, individuals can gain a better understanding of their sexual preferences, which may help them improve intimacy in relationships. Sexual health experts also emphasize that masturbation can have positive effects on mental health. It provides a safe and private outlet for sexual expression and can be a way for individuals to explore their desires without the pressure of external expectations. Furthermore, masturbation can help individuals manage sexual tension, reduce anxiety, and promote overall well-being. Importantly, healthcare professionals stress that masturbation only becomes a problem if it interferes with daily life or relationships. If someone becomes compulsive or addicted to masturbation to the point where it disrupts their work, social interactions, or romantic life, it may be a sign of an underlying issue, such as emotional distress or a need for healthier coping mechanisms. In such cases, experts recommend seeking guidance from a healthcare professional or therapist who specializes in sexual health or addiction. Before we continue with other aspects of expert opinions, it's also useful to highlight that many professionals encourage open and honest discussions about masturbation, as it is still often stigmatized. Doctors and therapists advocate for educating individuals about sexual health, including the benefits and normalcy of masturbation, to promote a healthier attitude toward one's body and sexuality. Before we wrap up, let's take a moment to recap the key points we've discussed today. We've explored the psychological effects of masturbation, both positive and negative, debunked common myths and misconceptions, and shared expert opinions on the health implications of this natural activity. From the mood-enhancing benefits and the importance of sexual self-awareness to addressing the feelings of guilt and the potential for addictive behavior, it's clear that masturbation is a complex and personal topic. However, when practiced in moderation and with a balanced perspective, it can contribute to overall well-being. As we conclude, it's important to remember that maintaining a healthy approach to masturbation is essential. If you ever feel unsure or concerned about your sexual health or habits, consulting a healthcare provider or professional can help guide you toward a healthier and more informed mindset. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more informative content on topics like this. Your support helps us continue to provide valuable insights, so make sure to hit that notification bell so you never miss an update. Thanks for watching, and stay informed.